sad statement that we can no longer trust the federal government.
What the doctor ordered is up for debate.
These changes were absolutely necessary adjustments to restore the agency to its role.
Federal vaccine guidance changing, public health trust falling, and healthcare getting increasingly political.
Vaccines are an act of care and connection.
This morning, Massachusetts Public Health Commissioner Robbie Goldstein goes on the record about shifting CDC guidelines, winter illnesses, and much more.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Good morning, everyone. It is Sunday, December 28th. I'm Ed Harding.
And I'm Sharman Sacchetti. And joining us at the table is Department of Public Health Commissioner Dr. Robbie Goldstein. Thanks so much for being here today.
Thanks for having me. Good morning.
Good morning. Great to see you this morning.
All right, let's start out with Health and Human Services Secretary Robert F. Kennedy Jr. He's overhauled federal policy and rolled back some of these federal vaccine recommendations. Now, Massachusetts has decided to break with the federal government on these vaccine guidelines. Massachusetts became the first to mandate insurance coverage of vaccines recommended by the state, even if the federal government stopped recommending them. And there's also been a collaboration now among Northeast states. All of these things, you've led these efforts. Why did you take this step?
Well, I think first and foremost, here in Massachusetts, we believe in science. We believe in evidence. And that is true for everything we do in public health. And so it was really important that in Massachusetts, we went out there with evidence-based recommendations that really were rooted in science so that people could trust us and people could know that we're trying to protect their health and the health of their families and their communities.
The CDC has recently revised its website to include widely debunked claims about autism and vaccines. What was your reaction to that when you saw that?
I think the first was sadness. Sadness that our federal government was putting out such mis and disinformation. I was also quite frustrated that we've allowed somebody who has no medical training, no science training, no real understanding.
Specifically, you're talking about?
Speaking of RFK Jr., the Secretary of Health and Human Services. Someone who has no training in infectious disease or vaccines, really an understanding of how vaccines work. And he's out there putting lies into the public domain and putting it, nonetheless, on a government website. And I think that is really dangerous. When that happens, how does anyone trust what the federal government is saying? How does anyone trust that we actually are here to protect their health and to protect communities?
So how do you get that trust? Obviously, you're going to push back. Obviously, you're going to say no. But still, there is the weight of the federal government behind it, and a lot of people are going to be influenced by that.
I think so. What we're doing here in Massachusetts is we are out there as much as we can speaking truth. And we're doing it in collaboration with people all around us. So you mentioned this Northeast Public Health Collaborative. We're a member of that collaborative. Collectively, folks from DC all the way up to Maine, we're coming together and saying science matters. And we are going to speak truth about public health and about vaccines. And we hope if we say it loud enough, if we say it often enough, that we can push back on the federal government. So
speaking of the federal government, the Federal Department of Health and Human Services says that Democrat-run states that push school lockdowns and vaccine passports during the COVID era have eroded trust in public health agencies. A broad statement. Is there any truth to it? Is it partially true? Is it true?
Well, I think COVID was challenging for everyone. And for folks who don't know, during the COVID pandemic, I was at CDC. I was at the federal government. I was in the room as we were making some of these decisions. Those decisions were challenging to make in the time, but they were necessary so that we could protect students and teachers. We could protect communities. If you think back to it, many, many people were getting sick. Thousands of people were dying from COVID. We had to do something to protect the people of America and protect people here in Massachusetts. I don't think that's what destroyed trust. Mm-hmm. I think what destroyed trust is when people took mis and disinformation and started to scream it loudly through a megaphone, right? And when that happened, and that's happening right now with RFK Jr., that destroys trust.
All right. Well, in a historic vote, the CDC's Vaccine Advisory Committee, they agreed to narrow the agency's hepatitis B immunization guidance for newborns. Now, a dose at birth is only recommended for those whose mothers test positive for the virus or whose infection status is unknown. And for other babies, it's up to the parents and their doctors to decide. And only then, the shots, they say, should begin at 2 months of age. What do you think the impact of this decision will be?
Well, what I hope is that here in Massachusetts, people continue to get vaccinated for hepatitis B. And if we look here in Massachusetts,
At birth,
greater than 97% of children get vaccinated for hepatitis B here in Massachusetts. We have a population that understands the benefit of the vaccination and listens to the recommendations. What I'm fearful of is that all the language coming out of the federal government will make it that much harder when the child is born. There's conversations that are going to need to happen now during the prenatal visits, conversations that happen at the time of delivery. It's a lot of pressure to put on the healthcare providers, the families, all because people who don't really have the science, who don't really have the knowledge, made a misguided recommendation.
I want to ask you, because what is wrong with letting parents decide after 2 months?
I think there's never a problem with having parents decide, right? Parents and providers, pediatricians, have conversations all the time about what's best for a particular child and a particular family, and that should continue to happen. But in this case, we have a significant amount of evidence that giving the dose at birth is beneficial, right? It prevents infections from moms who maybe didn't know they were infected with hepatitis B. It prevents infections that might happen during the first 2 months of life. And those infections are really significant. They're really consequential. Kids, babies who get infected with hepatitis B go on to develop cirrhosis, liver cancer, and can die from the infection. Why would we let that happen if we can prevent it with a dose right at birth?
So doctors are seeing an increase in flu-like illnesses, obviously, as we move into the flu season, through the flu season. Right now, influenza A is the dominant strain here in Massachusetts. A new variant is evading immunity and affecting more and more people. Are doctors bracing for I'm going to use the word brutal. I don't know if it's fair, but are doctors bracing for a brutal flu season?
You know, I think we're preparing for a flu season. Every flu season is different, and we have to be prepared for whatever might come our way. This flu season, we're concerned about this new variant that is circulating. We saw it circulating in Europe, in Japan, and other parts of the world, and it's here in Massachusetts. The thing that people should know is that it's not too late to get vaccinated. Getting vaccinated protects you from severe disease, from ending up in the hospital, from death from flu. So anyone who's not vaccinated should go out and get vaccinated.
Even in the middle of December here, right? Or the end of December?
At the end of December, the beginning of January, it's never too late to get vaccinated.
What do you say to people who say, what's the point? This strain doesn't match this new variant that's out there. How do you respond to that?
Well, there's not a perfect match between this vaccine and the variant that's circulating. It still provides significant protection. We know this from other parts of the world where we've seen people who get vaccinated are protected. They're less likely to end up in the hospital, less likely to be out of work for a long period of time. The vaccine still works, and people should still get it.
COVID still hangs in our conversation. So what are COVID levels like in the state right now?
You know, right now, we're at pretty low levels of COVID. We shouldn't fool ourselves that it's not going to go up. It likely will, but fortunately, at this moment, COVID levels are low. And that means it's a really good time to get vaccinated, right? Because when levels are low and you get vaccinated, you can build that protection before the levels start to rise in the coming weeks and months.
Have we, remember the phrase during COVID was herd immunity. Have we reached herd immunity in time? I mean, as COVID has existed over the last, 5 years, 6 years?
So, you know, we're in a very different place at the end of 2025 than where we were at the end of 2020, right, before vaccines were really widely available. At this point, nearly everyone in Massachusetts has had COVID, has been vaccinated for COVID. We've built some immunity. And so the disease looks really different now than it did 5 years ago. That doesn't mean that we shouldn't keep getting vaccinated. The vaccines still work. They protect people from getting really sick. They keep people out of the hospital. They keep people from dying. And so we still recommend the vaccine. But the disease certainly looks really different now.
And just quickly, how's been the vaccine uptake for COVID, and how has the flu uptake, the flu shot uptake?
We're seeing relatively low numbers of uptake both for COVID vaccine and for flu vaccine. Only about 10% of people here in Massachusetts have gotten their COVID vaccine. About 35% have gotten their flu vaccine. We want those numbers so much higher to build that herd immunity, to build that wall of protection.
Here's to your health. Our conversation continues after the break.